Hi, everybody. Dr. Daniel, and today I'm talking about the best over-the-counter drugs for migraine. Are you tired of suffering from debilitating migraine headaches? It's time to find some much-needed relief. While prescription medications can be effective, they often come with a hefty price tag and the potential for unwanted side effects. Thankfully, there are several over-the-counter drugs that can provide immediate and long-lasting relief for migraines. This article will explore the best over-the-counter drugs specifically formulated to alleviate the pain and symptoms associated with migraine headaches. From non-steroidal anti-inflammatory drugs, NSAIDs, to combination medications, we will delve into the science behind these drugs and how they work to target migraines at their source. This guide will equip you with the knowledge to make an informed decision about which over-the-counter drug is best for you. Say goodbye to the throbbing pain and hello to a better life with migraine. Understanding migraine and its symptoms. Migraines are not simply severe headaches. They are a neurological condition that can cause intense pain, nausea, and sensitivity to light and sound. Migraines last from 4 to 72 hours, which makes it difficult for sufferers to carry out their daily activities. Understanding the symptoms of migraine is crucial for finding the right over-the-counter drug for relief. The most common symptoms of migraines are throbbing or pulsating pain, usually on one side of the head, sensitivity to light and sound. These symptoms can vary in intensity and duration from person to person. It is important to recognize these symptoms early on to effectively manage and alleviate migraines. The limitations and problems of over-the-counter drugs for migraine relief. While over-the-counter drugs can provide significant relief for many migraine sufferers, it's important to understand their limitations. Over-the-counter drugs are not a cure for migraines. They're designed to alleviate symptoms and provide temporary relief. They may not be as effective for severe migraines or for individuals who experience migraines frequently. It's also important to note that overuse of over-the-counter drugs can lead to medication overuse headache, MOH, also known as rebound headache in the brain. Migraine is a process whereby the pain center of the brain, the thalamus, and cerebral arteries release inflammatory chemicals such as calcitonin gene-related peptide, abbreviated as CGRP. Too much migraine medication used by the patient can release CGRP, causing the headache to continue until the caffeine and migraine drug treatment is stopped. Because of these changes in the brain, all patients should limit the caffeine in their daily coffee and the caffeine they take in their Excedrin and any other acute treatment drugs for migraine they use to no more than 2 days a week. That's right, persons with migraine should at best completely decaffeinate or limit daily caffeine use to no more than 2 days a week. Caffeine is the number one drug that causes medication overuse headache, and many persons with migraine do not know this, and therefore they overtreat with caffeine. Up to 400 milligrams of caffeine a day is the upper limit for non-migraine persons. But migraineurs with frequent severe headaches should completely stop daily caffeine. The best over-the-counter drugs for mild to moderate migraines. For individuals experiencing mild to moderate migraines, non-steroidal anti-inflammatory drugs, also called NSAIDs, are often the first line of defense. NSAIDs work by reducing inflammation and blocking the production of certain chemicals in the body that cause pain and inflammation. Ibuprofen, also known by its brand names Advil and Motrin, is one of the most commonly used NSAIDs for migraine relief. It's available in various strengths and can be taken as a tablet, capsule, or liquid. Ibuprofen is known for its quick onset of action and can provide relief within 30 minutes to an hour. Another popular NSAID for migraine relief is naproxen sodium, commonly known as Aleve. Like ibuprofen, naproxen sodium works by reducing inflammation and relieving pain. It's available in tablet form and is typically taken every 8 to 12 hours, depending on the severity of the migraine. Combination medications, such as Excedrin migraine, are also effective for mild to moderate migraines. These medications usually contain a combination of acetaminophen, aspirin, and caffeine. Acetaminophen and aspirin work together to relieve pain, while caffeine helps enhance the absorption of caffeine and acetaminophen. However, Excedrin migraine, naproxen sodium, and ibuprofen are common drugs that cause medication overuse headache. The International Classification of Headache Disorders states that taking simple over-the-counter drugs like I've just mentioned more than 15 days a week can cause medication-overuse headache. For individuals experiencing severe migraines, over-the-counter drugs may not provide sufficient relief. However, there are still options available that can help alleviate the pain and symptoms associated with severe migraines. One such option is a class of drugs known as the triptans. Triptans work by blocking the release of CGRP chemicals, but they must be taken early in the migraine process to work effectively. Triptans can give a 2-hour headache-free experience in 60 to 70% of patients, if taken at the start of a migraine headache. There are 7 triptans in America, and 3 triptans, rizatriptan, known as Maxalt, sumatriptan, known as Imitrex, and zolmitriptan, also known as Zomig, have been released over the counter. Triptans can also cause medication overuse headache. Another option for severe migraines is combination medications that contain a triptan and a pain reliever such as sumatriptan and naproxen sodium. This combination medication, called Traximet, can provide more comprehensive relief for severe migraines and are available only by prescription. Understanding the potential side effects of over-the-counter migraine drugs. While over-the-counter migraine drugs are generally safe when used as directed, they can still have potential side effects. It is important to be aware of these side effects and consult with a healthcare professional if you have any concerns. Common side effects of NSAIDs include stomach upset, heartburn, and stomach ulcers with prolonged use. It's important to take NSAIDs with food to reduce the risk of stomach-related side effects. Triptans may cause mild side effects such as dizziness, drowsiness, neck or chest tightness, and tingling sensations. These side effects are usually temporary and subside on their own. It's also important to note that overuse of over-the-counter drugs and triptans can lead to medication-induced headaches, as mentioned earlier. If you find that you're relying on any drug too frequently for migraine relief, it may be time to consult with a healthcare professional for alternative treatment options. Triptans, if they take more than 10 a month, can cause medication overuse headache. Tips for effectively using over-the-counter drugs for migraine relief. To maximize the effectiveness of over-the-counter drugs for migraine relief, it's important to follow these tips. Number 1, start treatment as soon as possible. Taking medication at the onset of a migraine can help reduce the severity and duration of the symptoms. Number 2, take the medication with food. This can help reduce the risk of stomach-related side effects associated with NSAIDs. Number 3, stay hydrated. Dehydration can trigger migraines or make them worse, so it's important to drink plenty of water throughout the day. Number 4, keep a migraine diary. Tracking your migraines, including triggers, symptoms, and medication effectiveness, can help identify patterns and determine the most effective treatment options. Number 5, combine with lifestyle changes. Over-the-counter drugs should be used in conjunction with lifestyle changes such as stress management, regular exercise, and adequate sleep to reduce the frequency and severity of migraines. Alternative remedies for migraine relief. In addition to the over-the-counter drugs, there are several alternative remedies that may provide relief for migraines. These include massage therapy. Gentle massage techniques can help relax tense muscles and reduce the intensity of migraines. Herbal supplements. Certain herbs, such as feverfew and butterbur, have shown promising results in reducing the frequency and severity of migraines. Relaxation techniques, practices such as deep breathing exercises and meditation can help reduce stress and promote relaxation, potentially relieving migraines. It's important to note that while alternative remedies may provide relief for some individuals, their effectiveness may vary from person to person. It's always desirable to consult with a healthcare professional before trying any alternative remedies. When to seek medical attention for migraines. While over-the-counter drugs can provide relief for many migraine sufferers, there are instances when medical attention is necessary. It is important to seek medical attention if your migraines become more frequent or severe. Your migraines are accompanied by neurological symptoms such as confusion, slurred speech, or weakness on one side of the body. Your migraines are triggered by physical exertion, coughing, or straining. You experience a sudden, severe headache that is unlike any migraine you've had before. These could be signs of an underlying medical condition that requires further evaluation and treatment. Comparison of different brands and types of over-the-counter migraine drugs. There are several brands and types of over-the-counter drugs available for migraine relief. It's important to consider your individual needs and preferences when choosing the right drug for you. Some factors to consider include formulation. Over-the-counter drugs for migraines are available in various forms, including tablets, capsules, liquids, and nasal sprays. Choosing a formulation that is most convenient and effective to you is important. Dosage. Different drugs have different recommendations for dosages, so be sure to carefully read and follow the dosage instructions provided with the medication. Cost. Over-the-counter drugs vary in price, so it's important to consider your budget and insurance coverage when making a decision. Side effects. While the over-the-counter drugs are generally safe when used as directed, it is important to be aware of potential side effects and choose a drug that has minimal side effects for you. Consulting with a healthcare professional or a pharmacist can help you make an informed decision about over-the-counter drug and which one is best for your specific needs. Conclusion. Migraines can be debilitating, but finding relief doesn't have to be a daunting task. Over-the-counter drugs can provide significant relief for many migraine sufferers, ranging from mild to severe migraines. Understanding the symptoms of migraines and the science behind these drugs is crucial for making an informed decision about which over-the-counter drug is best for you. Whether you opt for a non-steroidal anti-inflammatory drug like an NSAID for mild to moderate migraines or triptans for severe migraines, it is important to follow the recommended dosages and guidelines for safe and effective relief. Additionally, considering alternative remedies and making lifestyle changes can complement the effectiveness of over-the-counter drugs. So, remember your migraines, if they become more frequent or severe, if you experience any concerning symptoms, it's important to seek medical attention from your healthcare professional, who may provide further evaluation and guidance to ensure your migraines are properly managed. Say goodbye to the throbbing pain and hello to a better life with migraines. With a comprehensive understanding of over-the-counter drugs and alternative remedies, you can find the relief you've been seeking for your migraines. Take control of your migraines. Reclaim your life today. Thank you for listening to this talk. Please click on like or subscribe down there, and I'll see you again on the next talk.